Welcome to our new video, Expert Tips, How to Pop a Pimple Safely and Effectively. We know, pimples can be a real party pooper and popping them might seem like the quickest solution. But did you know if done incorrectly, it can lead to scarring or even infection? Today we're going to share some expert tips from Healthline on how to safely and effectively pop a pimple. But remember, if you're dealing with persistent acne issues, it's always best to seek professional advice. Before we dive into the steps, remember it's always better to let a dermatologist handle severe acne. Popping pimples may seem satisfying, but it comes with risks. Now you might be thinking, what could be so risky about a little pimple popping? Well, let's delve into that. Popping pimples, especially without proper care, can lead to scarring and infection. It's like opening a gateway for dirt and bacteria to invade your skin. Not the most pleasant of thoughts, is it? And it doesn't stop there. Some pimples, particularly those filled with blood or those pesky blackheads, can pose even more problems when popped improperly. These types of pimples are typically deeper and more stubborn, making them trickier to deal with. Aggressively popping them can cause deeper damage to your skin, leading to more severe scarring and potential skin discoloration. So it's clear that popping pimples is not a risk-free endeavor. But sometimes, we all know, a pimple just needs to be popped. So, if you have to pop a pimple, how do you do it safely? Let's find out. When a pimple is ready to pop, it will have a firm white head. Now let's walk through the steps on how to safely pop a pimple. Remember, this isn't a race, so take your time and be patient. First and foremost, cleanliness is key. Start by washing your hands thoroughly with warm water and antibacterial soap. It's crucial to remove any bacteria or dirt from your hands to prevent it from transferring to your skin and causing further infection. Next, clean the affected area. You can use a gentle cleanser or even simple warm water. Pat your skin dry, don't rub it, as rubbing can irritate the pimple further. Now for the tricky part. Take a sterile needle. You can sterilize a regular needle with rubbing alcohol or by holding it under a flame until it's red hot. Then let it cool. Gently prick the very tip of the white part of the pimple. The aim here is just to break the surface of the pimple, not to jab it deep. After the pimple has been pricked, wrap your fingers in a clean tissue or use a clean cotton pad. Apply gentle pressure on either side of the pimple. If it doesn't pop, don't force it. Forcing a pimple can cause scarring or spread bacteria. If the pimple is ready, it should pop with minimal pressure. Once the pimple is popped and the fluid is out, clean the area again with warm water or a gentle cleanser. Apply an over-the-counter antibiotic ointment to prevent infection and help the healing process. Last but not least, resist the temptation to touch the area after you've popped the pimple. Your hands can introduce bacteria that can lead to infection and further breakouts. Remember, excessive force can damage your skin, so be gentle and patient. Popping a pimple is not always the best solution. When in doubt, it's always best to consult a dermatologist or skincare professional. They can provide more personalized advice based on your skin type and condition. Popping isn't the only solution for pimples. There are alternative acne treatments. Over-the-counter creams and gels, for instance, are readily available and can be effective for mild to moderate acne. They often contain ingredients like benzoyl peroxide, salicylic acid, and sulfur that help to reduce inflammation and clear the skin. For more severe acne, prescription medications may be necessary. These can include topical retinoids, oral antibiotics, or even hormonal treatments. It's crucial to remember that these are not one-size-fits-all solutions, and what works for one person may not work for another. Home remedies can also be a helpful supplement to these treatments. Simple changes like a healthy diet, regular exercise, and proper skincare routine can significantly impact your skin's health. However, these are not quick fixes and require consistency and patience. But remember, if you're dealing with persistent acne issues, it's always best to consult a dermatologist. They can provide a tailored treatment plan that addresses your specific needs and skin type. Now that you know how to pop a pimple safely and the alternatives, we hope you'll make the best decision for your skin. We've covered some expert tips on how to pop a pimple safely and effectively. To recap, remember that popping pimples comes with risks, but if necessary, there are safe ways to do it. We also discussed alternative acne treatments that can prevent the need for popping. Always be mindful of your skin's health and don't hesitate to seek professional advice for persistent acne issues. Thank you for watching. What's your opinion on these tips? Do share in the comments below. And remember, your skin is unique, treat it with respect.